afternoon to everybody. On behalf of organizer of the meeting, the Institute for Healthcare Management and the Mental Power Foundation for Brain Health, as well as partner the Polish Neurological Society and the Polish Psychiatric Society, I welcome you all very warmly. We meet today to talk about the brain health, especially the challenges of developing the brain plan for Poland. Such a document was created in 2010, but has not been adapted for implementation at the level of the Polish healthcare system. So our aim is to unite stakeholders from across the brain community to develop policy recommendations and advocate for its implementation. It's essential to have a joint approach for the brain disorders because in research and practice within brain disorders were fragmented across disciplines, neurological and psychiatry, not only in Poland, but also in other countries, as we know. And today there is a greater awareness of common challenges and opportunities to manage brain disorders through our more integrated approach. We're all seeking for more integrated approach. So neurological and mental brain are the #1 cause of disability and second cause of death worldwide. So the cost of the brain disorders in Europe amounts to almost 800 billion euro annually, more than all other major non-communicable diseases combined. Furthermore, it's been estimated that 1 in 6 people across Europe countries, it means around 70%, had a mental health issue in 2016, before COVID pandemic, totaling nearly 84 million people in Europe. Moreover, depressive disorders are predicted to become the leading cause of burden by 2030. The high burden of brain disorders and their socio-economic impact must be recognized on EU level and member countries such as Poland. Today, we are privileged to host a speaker, colleagues from the European Brain Council and its member organizations such as the Norwegian Brain Council and Finnish Brain Council. So allow me to introduce our guest. I warmly welcome Ugo Hermanten, Advocacy and Communication Officer from European Brain Council. Hello, Ugo. I would like to warmly welcome Professor Mika Markkainen, a Chair Finnish Brain Council, a Professor of Neurology, University of Oulu, Finland, as well Professor Persson, General Secretary, Norwegian Brain Council. And our speakers, we also have Silja Nicolin Angels from Norwegian Directorate of Health. From the Polish side, I would like to warmly greet Professor Alina Kułakowska, President Neurological Society, Professor Agata Schulz, President Polish Psychiatric Society, Professor is with us Professor Halina Sienkiewicz-Jarosz. She's chair of Polish Neurology Council, and as well we've got with us Dr. Małgorzata Gałązka-Sobotka, the Director Institute of Healthcare Management, and also Professor. Okay. And also the former president of Polish Neurological Society, Professor Jarosław Sławek, promised me to join us, but I know that he's in the trip abroad. We cannot wait for him. Probably he tried to join us later on. Before I turn the floor over to our guest, let me thank you again for your time and willingness to share with us your experience and planning and implementing brain health strategies in our countries, as well as the forming the country brain council in your in Finland and in Norway, and leading brain advocacy efforts. Briefly in our agenda today, we will hear 4 presentations And after Q&A session will be a time for roundtable discussion in Polish about the future of Polish brain health and brain health prioritization in public policy. Do you hear me or no? Okay. Okay, is everything technically is okay. So now I would like to give the floor to, accordingly to our agenda, to Hugo Hermantin. Please, the floor is your, Hugo, and we would like to know a little bit more about the European strategy and all advocacy efforts you made as a European Brain Council.
Good afternoon, everyone. Thank you very much for the invitation and for the opportunity to present the work that we've been doing at the European Brain Council. And thank you, Isabella, for organizing this webinar. I'm going to quickly start by saying that we are very happy and hopeful about the developments that are currently happening in Poland. It's absolutely both timely and crucial to see such efforts being conducted at national level and in Poland. And so, yes, I work for EBC, which stands for the European Brain Council. We are basically a non-profit organization that is based in Brussels. And we are membership-based, meaning that we represent professional societies over what we call the brain community, meaning some neurologists, psychiatrists, neurosurgeons, patient representatives. We have a pretty wide and diverse array of members. We also closely collaborate with national brain councils, which do pretty much the same work as we do, but at national level. And we work closely also with some key industry partners to try and progress brain health, brain research, and brain innovation in the European policy agendas. And we have actually two main core activities at EBC. The first one is being engaged in research-oriented projects, whether they are EU-funded or privately funded. And the second core activity that we do is more oriented towards policymaking and advocacy. And this is the one I'm going to focus on today. So, as I said, we are a membership-based organization, and our main purpose when conducting these activities is to try and bring the community together, to get them to speak with one voice, especially when it comes to speaking to policymakers and decision makers, and to agree on a set of common priorities that can be then presented to these decision makers at the EU level. This set of priorities is currently encompassed within what we call our 2024 European Elections Manifesto, which I strongly invite you to go and have a look at on our website. It's the result of several discussions with our partners to have this common list of priorities for the current mandate of the European Parliament. Our main work when it comes to advocacy and policy is focused on something that might sound very obvious to you, but that is unfortunately not that obvious yet to policymakers and decision makers in the European Union, is the importance of the burden posed by brain conditions, neurological and mental alike. So we know that this burden is absolutely staggering. It was mentioned by Isabella in the opening of this webinar. It's by far the leading cause of disability in the world. It's the second leading cause of death. And the cost to the European Union is very difficult to precisely estimate, but it ranges between 800 billion euros a year and 1.4 trillion euros a year, which means that the lowest estimate is that it's like the GDP of Poland was fully used to match the burden posed by brain conditions in Europe. And our main goal is to try and get policymakers to understand the importance of this burden, the fact that this burden is going to keep on growing because the European population is aging, and to try and get them to act to reduce this burden. And to do that, we have to understand better the way political decisions are made in Europe. And paradoxically or not, to understand that, we have to start looking at the international level, and in particular, the work being done among the United Nations. which, as you may know, has established what we call the 2030 Agenda, which is basically a list of goals, the Sustainable Development Goals, which are meant for member states to pave the way towards a more sustainable future. One of these goals is dedicated to health, and among this specific SDG is a specific target which relates to non-communicable disease and then to brain health. All member states have committed to implementing this agenda. To try and help member states achieving these goals, the WHO, so the World Health Organization, has issued several action plans, guidelines, and recommendations to help member states in implementing this agenda. These plans we will come back to in a few minutes, but they have a very strong influence on the way EU policies are decided and shaped, because the European Union is a group of member states which all committed to achieving these goals. So in order to influence the EU policy agenda, having an influence on the international agenda is absolutely crucial. And it also helps not only influence the European Union decision makers, but also the member states directly, which have to design policies based on the requirements both from the United Nations and the European Union. Knowing that we've agreed on a common set of priorities with the EBC memberships, we designed, from our election manifesto, a campaign which focuses on two specific policy asks. The first one being the creation of an European Parliament intergroup on brain health and research, and the second one being the development of an EU strategy for the brain and the support to the development of national brain strategies within the EU. And I'm going to start by presenting the second one, and I'll come back to the parliamentary intergroup a bit later. So the main rationale behind our policy ask on a coordination plan for the brain is obviously to try and tackle this burden, and also to notice the fact that the United Nations has issued two action plans, one specifically on neurological disorders and the other one on mental health. These two plans are set to expire or to be implemented by 2030 or 2031. Another very important point to notice and to mention there is the fact that the policy recommendation they put forward to tackling the burden of brain conditions are very similar, whether it is for neurological conditions or for mental health conditions. And the last thing we need to bear in mind is the fact that we all voted for members of the European Parliament, MEPs, a few months ago, meaning that their legislative mandate is set to come to an end in 2029. All of that leads us to know that the time to act is now. If we want to reach the KPIs and the targets set by the United Nations, we absolutely need to act during the current European Parliament mandate. We also want to make the most of the several initiatives that already exist in the EU when it comes to tackling this burden of brain conditions. One of these initiatives is the future European Partnership for Brain Health, which is set to start next year, and which is basically structuring all the research ecosystem on the brain in Europe for the next decade. We also have several other initiatives at EU level, such as the Healthier Together pillar on mental health and neurological disorders. And we also know that the Commission has highlighted several priorities which have a direct link to brain health. And if we make the most of what already exists at EU level, we need to do the same for what exists at national level, because one of the key requirements of the action plans I just mentioned is that all member states must have established a national strategy for neurological and mental disorders by 2030 or 2031. We know that some countries in Europe already have such a strategy implemented. For instance, Norway, which had one from 2018 to 2024 and is in the process of renewing it, if I'm if I'm correct, but we will hear more about that a bit later in the webinar. And we also know that Switzerland recently adopted a Swiss brain health plan, which is very comprehensive and overarching and very ambitious, and that tackles both neurological and mental disorders. So, knowing all of that, we are trying to currently push the European Commission by working closely with its Directorate Generals on Public Health to develop an overarching EU brain plan that would support member states' initiatives in establishing their own strategy, and that would also ensure that these are coordinated efforts and that member states can have all the support they should have and they can have. And this process of trying to push the Commission forward this overarching plan is actually coming to an end next week, because we will present the first draft of our joint statement on the need for this EU coordination plan for the brain in Luxembourg next Tuesday. These are some of the main pillars that we think should be embedded in that coordination plan, but I'm happy to come back to that a bit later if there are some questions on that. The second policy ask is closely linked to the first one, is the creation of an EU intergroup on brain health and research, which instead of targeting the European Commission, is now trying to involve the European Parliament. Because basically, an intergroup is a way to get members of the European Parliament work and commit to work on a specific issue, in that case, brain health, over the next 5 years. It's also a way for them, when designing policies, to ensure that these decisions are rooted in evidence-based scientific knowledge. And it will also be a great way for these MPs to act as relays, as an interface between the European Union level and the national level. It's a process that is ongoing at the moment, and that is coming to an end at the end of the year, where we'll know whether this intergroup will come to life or not. But just to give you a brief overview of where we stand at the moment, we've approached pretty much half of the European Parliament. We are supported by over 120 now organizations from all across the EU. And we are really trying to also involve the European Parliament in this effort. And I will now just quickly summarize the fact that all these efforts are also meant to have tangible impacts at national level. And so, as you can see here, this is a map of the current national brain councils that work with EBC, that work with us. And we are very happy to know that probably the spots on the map for Poland is going to change color very soon. And I just want to end this presentation by thanking you very much for organizing this webinar and reiterate the fact that we are extremely hopeful about the initiatives happening in Poland at the moment, and that we will support them in any way possible. Thank you very much. And if there is any question, please don't hesitate to ask.
I will quick Q&A session after the whole presentation, although maybe if somebody would like to ask the question right now, is it possible? Just raise your hand. Okay, so later on we ask a question to all of you. Thank you to provide in such a quick time the information about all activities ABC taken across the Europe, especially focused the campaign in the last few months. Also, I would like to mention that as a Polish, I think about my foundation, but also the healthcare in Łazarski University, as well the Polish Neurological Society, Polish Psychiatric Society also support this campaign. We are among 101 organizations that support the campaign and your efforts. Thank you. And now we've got a chance to hear more about the country experience, how to prepare and develop and implement the strategy, and it gives us the broad impression if it's possible, if in our country, so maybe we can adapt some good practices here in Poland. And now the scene for me Mika Martinkainen is open. The floor is yours. Professor, start your presentation, and yeah, it's time for you.
Many thanks for the opportunity to present some of our data to you. So just without further ado, I will tell you something about the current state of Finnish brain health initiative and how we try to foster a better brain healthy society for everyone from birth to old age. So as already mentioned before, so there are several international initiatives and programs already addressing this topic, and we are definitely in Finland. We are trying to align our program particularly with the initiatives of the UN and the EAN brain health strategy and the brain health mission, so that our work aligns with these more international initiatives. The Finnish Brain Health Initiative actually involves several organizations under the same umbrella. I'm primarily representing the Finnish Brain Council, which is a member of the EBC. It was founded in 2012, and it's an umbrella organization with 14 scientific associations, including the Finnish Psychiatric Organization, the Finnish Neurological Organization, and others, and also includes several patient organizations that contribute to our work, and we have also some pharma companies associated. Then we have the Neurocenter Finland, which is primarily involved in fostering brain health and neuroscience in Finland, and communication and collaboration between different universities and different institutes in Finland, but also very much interested in the RDI and how to develop connections with industry. So just to mention, the National Brain Health Program already launched as kind of a pioneer step in a way in how we address brain health today. This was launched by the Finnish Brain Association, which is originally the Stroke and Aphasia Patient Organization. They also a member in the Finnish Brain Council, and this is today we see the Brain Capital Program and the National Brain Health Program as the sort of very important early step that we incorporate and that adds to the full program we are planning to work with in future. Just to show you some examples of some practical things we've done in recent times to promote brain health. So this is obviously not the full list, but just some. I would like to point out some practical examples for various perspectives. So the school challenge is obviously related to the brain health mission of the EAN, which really aims at elevating the knowledge and awareness of brain health, making it sort of more salient for everyone and for lay people in society, that things that are supportive of brain health, things that are protective and important to your brain health, and also on the other hand, things that might be detrimental for your brain health. I think Professor Blum has in his presentations very nicely summarized this as everyone knows that you should brush your teeth in the morning and in the evening to keep your teeth healthy, but people are not that well aware of how to keep your brain healthy and what you should do and what you should not do in order to have a healthy brain throughout your life. And the school challenge is sort of a practical way to get children at school and vocational institutes involved in brain health, get them on board to work in a sort of competition and activation work. This was first performed as part of the EAN conference in last summer in Finland. We will redo it again next year, as we as you know, we will have for some reasons we will have the EAN Congress again in Helsinki next summer, and we will reinitiate the school challenge. So just to summarize, I think the experience, at least in Finland, was very positive. So we got many schools that were active in the program. We got like magnificent results and the presentations that the schools performed, and we had an event related to the EAN Congress where the winners were then awarded, and it was widely noted also in the international media, both on TV and in printed media. So definitely one way to kind of raise the awareness of brain health and getting young people involved. Then I will just mention a few activities we've done with the Finnish Brain Council. These are obviously closely related to the important work by the EBC that Hugo mentioned earlier in his talk. So we reached out to the EU election candidates in Finland before the elections. We got a list provided by people at the EBC of selected candidates, and we addressed them by email, translated to the common message, translated in Finnish, and got responses also from some of the candidates and also present European Parliament members. So a sort of early step to get contact, to form some sort of contact to these people, and also paving the way to influence people then in the European Parliament, which will be definitely important for us. We also wrote a letter to the main national newspaper in Finland. This was published in the end of May. And we just highlighted in a short piece the importance of brain health in EU health policy, how brain research should be prioritized in research funding, and how a comprehensive EU level program on brain health would be very important for us. And this also was noted fairly widely and also distributed on social media by us and others. So sort of fairly simple things, practical things that in our experience were ways to get to raise the awareness and keep the topic of brain health on the agenda, where obviously there are many competing things and issues all the time, and it's a big work for us, I think, overall to keep our mission on the agenda. Then I will just mention some strategies for brain health. These are just examples of publications. Obviously, there is a lot of scientific literature on this topic, but just to show the lifespan perspective. So it's obviously well known that the foundation of brain health, as we all know, it's already laid before birth. And many important things happen in early childhood, throughout the childhood, during education and later on in life. How things are in the family, how things are for the expecting mother, and so forth. These are very important for brain health throughout the life, and this is why I think it's very important that we adopt a lifespan perspective, so that we focus on things already from the early age and throughout to elderly people, and not only focus on the neurological disorders that may present later on, but also how to prevent and how to create surroundings in society that are beneficial for healthy brain. And these obviously include nutrition, these include physical activity, sleep, the vascular health, and so forth. This also means that there are various opportunities that are a bit different in various parts of the lifespan, but various opportunities throughout where we can both help people with neurological disease, but also prevent and promote also brain health and brain wellness. I think it's very important, and in the Finnish perspective, we try to balance both, that we also keep in mind the brain economy, the importance of well-being on the side of mental well-being and brain well-being, but also try to improve brain health for people with various brain disorders, both neurological and psychiatric brain disorders. And this is also similarly in the EAN brain health strategy, the perspectives of preserving, protecting, and planning for brain health, which I think is fairly nicely shown in this image, which you can find in detail on the EAN websites. So that combines the individual things, what people do for their own benefit, for their own brain health, keeping in mind healthy habits, healthy nutrition, physical activity, sleep, education, and so forth, but also things happening around you in society, and which I think is very, very important, the societal level, where the decision making in national governments, legislation, education systems, working surroundings, and so forth, and also on the EU level. So this is very important, a foundation for brain health. And I think when we look in the long run, it's extremely important that we are not focusing only on individual patients and healthy individuals in terms of prevention, but also we try to actively affect on the societal level to improve brain health for everyone. And this is also nicely shown on the WHO position paper on optimizing brain health across the life course. We see the physical health, healthy environments for individuals and families, safety and security in society, learning, social connection throughout the lifespan from early age, during the education years, in working life, and social connection in the later stages of life. Access to quality services, which we know is unfortunately not equal even inside countries, and particularly within EU, we have a lot of health disparities in access to quality services, and I think this is also in future a main thing that we need to tackle and to provide good access for everyone to services and healthcare. So future work for the Finnish Brain Health Initiative. We think it's very important that we promote awareness in society of brain health and brain wellness, not only of diseases, but also how people with good brain health, how they can preserve good brain health, how they can promote well-being for themselves in society and for their families. Promote research both on healthy brain function and, importantly, obviously, also on brain disorders. So we need research funding, we need research opportunities, we need because science-based and evidence-based initiatives must be based on solid research and publication-based evidence-based work. In terms of details within brain disorders, I think we have to have a balanced approach where we tackle prevention, but also diagnostics, treatment, and rehabilitation of brain disorders. And this should be all-encompassing throughout the spectrum of disorders within brain. As I mentioned earlier, I think it's very important that we promote changes and efforts in society, in social policy, education, legislation, in economy that are beneficial for brain health for everyone. And I think, you know, in overall, we should say that in societal perspective, ideally, we should always keep the brain health perspective in mind when we change legislation, when we think how society should be working. We should think it also from the perspective of brain health, how these changes affect brain health for people, whether we talk about changes in education, whether we talk about changes in let's say alcohol legislation or tobacco legislation and so forth. Very important to keep in mind. And I think this could be summarized as the goal of being brain health from birth to old age, a brain healthy society. Some points to remember for future work. We all know that change requires time. We have to be patient, but we need to take determined steps forward. So keep in mind that this is not easy and this is not fast, but we need to be very, very patient, but also very, very determined to keep things moving forward. There needs to be continuity and sustainability. This cannot be an effort that relies on some individuals only. There has to be key individuals. There have to be people who really shoulder the burden and are sort of champions of brain health in countries. But this has to be a wider effort, and we need to continuously also try to involve other people and take people on board. I think as we've unfortunately have sort of hard times in economy for various reasons, as we all know, there might be sort of difficulty in convincing decision makers and governments that efforts in prevention are important, because it takes time to realize the gains. But we have to make the decision makers understand that this takes time, but still the effort that the benefits will come later on. They are still very, very important, and in the end of the day, often they are very worthwhile in terms of the money consumed and the benefit we gain, but it takes time. And also, I think, you know, as a clinical doctor, I would stress the importance that even though I 100% agree that brain economy, well-being, preventive measures are very important, but we have to remember that there are people with brain disorders, people with mental health disorders, and with disabilities, and we cannot forget them. They are very important for us, and we need to be the voice, we need to be the champions of these people, and also when we communicate to decision makers. This is very important for me. And I trust for every one of us. We have to work to keep the brain health efforts on the agenda of national governments and the EU. And just the final points. Improving brain health is a mission for everyone, also the vulnerable ones. And it's important we keep everyone on board. We do not leave anyone behind. And this is my final slide. We need brain health from birth to old age. We need a brain healthy society. Thanks for your time. Thanks for the opportunity to present.
Many thanks, Professor Martikainen, for a very comprehensive presentation and the close message that we need to work on the brain health throughout the whole society, but also through the whole lifespan. This is a very important, and I think that the Finnish vision is one step before maybe other countries also, because it's a visionary, much more than only practice for implementation. Thank you so much. And now the floor is for Silja Nicole Andelsen. Please, Silja, start your presentation. And I've got a pleasure to talk to you a few weeks ago, and I know that your strategy is also so comprehensive, and you've got a first result after a 4-year period. So we are curious to know more about the Norwegian strategy and plans.
Thank you so much for the invitation. I'm a really proud project manager for the Norwegian Brain Health Strategy, and I work in the Norwegian Directorate of Health. So I'm going to tell you a little bit about our strategy, our current strategy, and also what we have learned from working with our first national strategy. The Norwegian Brain Health Strategy was launched in 2017 and has an active period from 2018 and end this year. And it was developed by the Ministry of Health and Care Services with a lot of input from user organization, municipalities, health care services in the specialist healthcare, and of course the Brain Council and us in the Norwegian Directorate of Health. And it is the first political brain health strategy in the world, as we are aware of. It is coordinated by the Norwegian Directorate of Health on behalf of the ministry. And this strategy consists everything from preserving and developing a healthy brain all the way to brain diseases and injuries. So we include psychiatric and neurological diseases and conditions, injuries, and also substance use. So our current consists of 4 main goals, and it has so much as 29 sub-goals. So the first goal is good brain health throughout life. The second one is more user-oriented healthcare and better support for caregivers. The third one is enhanced pathways, and the last one is increased knowledge about the brain as an organ and also brain diseases through research. We have organized the project as we do with all other projects in the Norwegian Directorate of Health, with a project owner and a project manager and also team members. But the crucial part of the organization is that we establish a partnership. And the partnership consists of different stakeholders from the municipalities, specialist health services, user organization, the Brain Council, and the different professional communities. And this has been a really important group working with the brain health strategy. We have learned a lot of things working with the brain health strategy. I'm going to talk you through a couple of them. And the first one is, of course, establishing the partnership. It has been really crucial because we can, from different angles, we can look at what is difficult in the field of brain health and brain diseases, but also we can come together and find possible solutions. So we can work towards the same goal in the field of brain health, and that is really important for us. We also have, I believe, an advantage since it is a political strategy. Because a political strategy carries out the weight of the government endorsement, and for us it can be, for example, easier to implement the strategy. And it's easier to point out responsibilities to the health and care services. When we got the brain health strategy, the definition of brain health was a really new concept for us in Norway. So the first we had to do was to find out, how do we define brain health? What does it mean for us? And also we have to find out who is responsible for what, because brain health concerns a lot of people. So we have to find out, for example, what is my role and what is the role of the specialist health care services. And we also have worked a lot of raising awareness on brain health, and it also is because it is a new concept, and a lot of people do not know what they can do to take care of their brain health, and a lot of people haven't even, when we got the strategy, haven't even heard about brain health, and that also was also among my colleagues. So we believe that it is important to raise awareness about brain health because it is a huge prevalence of brain diseases among us, and it has significant social economic burden. So we believe that making higher brain health literacy in the population is really important, as well as more knowledge in the health services. We have shifted our view midways in working with the strategy because we see that it is a high prevalence of comorbidity and multimorbidity between in those people who is affected by brain diseases, and that affects them as the people that are having this diagnosis, and also their loved ones and the society. So we now go for a more holistic approach to address challenges that people with brain diseases are living with, and not just like diseases itself. And we believe that this approach prevents duplication of effort and ensures that all available resources are utilized more efficiently. When we started working on the brain health strategy, it's like there's a lot of statistics on different diagnoses, but we haven't got a statistics collectively on all the brain diseases. So we have started with making a report this year where we have collected all the brain diseases in a report for those who get treatment in the specialist healthcare services. And we did it because it is challenges for us to measure progress in brain health when we do not have statistics on brain diseases. So, since the strategy we have now is ending this year in December, we have gotten in the Norwegian Directorate of Health an assignment from the Ministry of Health and Care Services to prepare a draft for an updated brain health strategy. And primarily, we should look into developing new sub-goals. We were also going to make up a status in the brain of in the field of brain health, so we can see how far we have come with our work on the current strategy. And all this we're going to do in our deadline is 1st of May next year. So I'm not going to go through this because of the time, and it's a lot of information. So I will send a PDF of this to you, Isabella, so you can provide this to those who want it. But we have gone out really broad to get information from different stakeholders in kind of different angles to get important information so we can make a strategy that is effective. And we about mapping the status of work on brain health in Norway, we gave the assignment to a consulting firm called Oslo Economics, and they have had different workshop and dialogue with stakeholders, and also had the survey on to get information about status on brain health in Norway. And the short summary of it is that several of the sub-goals had been met as a result of the strategy's effort, but some of the sub-goals has been achieved, but not with direct connection to the strategy. And there are also some of the sub-goals we have not achieved. And I do have to say that with the 29 sub-goals of the strategy, it was the sub-goal was difficult to work with because they were enormous and precise. So it was also difficult to know if we achieved the goal or if we didn't. But the Oslo Economics have several recommendations for the next strategy, and they recommend that the strategy must clarify the target group of the strategy and the responsibilities working with the strategy, and also it needs to have clear funding. The strategies should also focus more on brain health and complement other relevant strategies. Another recommendation is that there was a need for specific metrics or indicator to see if we achieve goals and also make the strategy more binding. And it was also recommended that we have a clear timeline for goals so we can kind of prioritize when we're going to work with towards different goals. And it also makes it a little bit more binding by doing that. In those goals, sub-goals, it is beneficial when working in it. We should make up a baseline measurement before starting working on them. And they recommended us also that we consider what approaches to use when we're working with the strategy, such as funding and how to organize the work of this new strategy. We in the Directorate of Health, with help of a lot of different stakeholders and partnership, have worked out a draft of a brain health strategy that is on a public hearing now. In the strategy, we have different recommendations for the Ministry of Health and Care Services for the next updated brain health strategy. The first one is that we recommend that working with the strategy should consist of a holistic approach. And we also believe that it is important to have fewer and more clearer sub-goals, so it is easier to measure the goal to see if we have reached it or if we haven't, and have to approach it in another way. Yeah, and we also recommend that the commitment is increased, and it is also developing a more like action plan for following up the towards the different goals. For instance, how we're going to work with it and who's responsible for what. We also recommend, because we have been working for with brain health strategy for, what is it, like 6 years, and we have gained a lot of experience from working with it, just like what's not working and what is working. So we want to build on the experience that we have gained from this strategy period, and also we want to look into what other countries are doing on brain health, so we can learn from other countries. And we also want to look into what how Norway is working with strategies from other health areas, so we can like find the best practice in working with the strategy. There's more recommendation from us. We have, it's been important to us, and a lot of the stakeholders have given input that it is important that the strategy has a clear message and a clear direction, and doesn't have so much words. It's more understandable what direction we're going to. And we also recommend that halfway the period of the strategy, we recommend that it makes an evaluation, so we can see what goals we are headed to, and what goals we struggle with. So we have to find out another approach to meet the goals. We strongly recommend that we continue the collaboration with relevant stakeholders, such as the partnership and other stakeholders, to gain insight into both challenges and also possible solutions in the field of brain health. We think that the 4 goals that is in the current strategy are good, and we recommend that they continue in the next strategy. And we have, for the coming strategy, recommended that the effective period should last from 2025 to 2031. And the reason for that, it's some years, so we have the possibility to implement, because it's a lot of work. So and we have recommended a lot of sub goals to work with, 18 sub goals. So we believe that it would be beneficial to have several years to work with it, and also it matches the strategy for the WHO, and also the action plan for the epilepsy and other neurological diseases, so we can kind of like see them together when evaluating. So my last slide. Now we have conducted a lot of information from stakeholders to the updated strategy. It's been really important for us to do it like this, to find out how we're going to work with it and efficiently. And it has been on a review in my workplace, in the Directorate of Health and Care Services, in the different departments. And we also have a public consultation now as we speak on the updated brain health strategies, so the public can give their input to the strategy. So we are going to send the strategy to the Ministry of Health and Care Services May the 1st next year. And when we have sent the draft, it is up to the Ministry of Health and Care Services to decide how much they want to use in the strategy, and we hope they use everything. So they have kind of the final decision-making authority when they're going to launch the new brain health strategy in Norway. So that's it. Thank you very much.
Thank you, Silja. Very, very inspired and comprehensive. Your strategy is, and even the approach of cooperation with broader stakeholders, and then even consultation of the final document. This is something that we always dream to have here in Poland. So from our perspective, thank you. And so much. And the last but not least presentation today will be from Professor Henrik Persen from Norwegian Brain Council. We are very keen to hear you and interesting about your point of view in developing and introducing the strategy in cooperation with Directorate of Health. So the floor is yours.
Thank you very much for the invitation to speak to you today regarding the experiences we have here in Norway. Not so much about the brain health strategy, because Celia has covered that very well. But I was asked to talk about the role of the Norwegian Brain Council towards the Norwegian Brain Health Strategy. And I will start out saying that we have, if I can change my slide here. Nope. Yeah, there it goes. The Norwegian Brain Council consists of 77 patient organizations, medical professional associations, and scientific institutions. So we have quite a broad network and representing a lot of different environments working towards better brain health in Norway. And I will go back to actually 2014 to say something about the role of the Norwegian Brain Council, because the first steps towards the brain health strategy was actually taken not so much by the Brain Council itself, but by several patient organizations that started working together to show that the challenges they faced were similar. And they started working together to show that their needs were common, and we all recognize the needs they advocated for, and that was more research, better treatment and rehabilitation, and less differences within the health services. So I will say it was, when I say several patient organizations, it was mainly 4 organizations really going together and joining forces. By the year later, in 2015, these organizations, which were in the field of neurology, by the way, they joined forces with the Norwegian Brain Council, and the Norwegian Brain Council overtook the goal of having a brain strategy. And as a result of standing together, the Norwegian Brain Council made it visual that brain diseases represented a huge burden of disease. Because when we were not doing advocacy work for one-on-one diagnosis, summing them together in a category called brain diseases, we could show that the burden of disease was approximately 26% of the disease burden in Norway. And this is what we have shown here in the few pictures, that the Norwegian Brain Council really started showing the total burden connected to brain diseases. And we got quite good success in getting political awareness by doing the communication this way. And I think the key point of success was that both medical patients and researchers were standing together and had I will say, a perspective that were going above the single diagnosed perspective. So these are some nice pictures from the period where we were invited both to the Prime Minister, the Health Minister, and the Directorate of Health was given the task to create the first status report on brain health. This was back in 2016, and it led the way for the first national brain health strategy, which Celia has given a good presentation on. I will say, if we look into the role of the Norwegian Brain Council, as a result of the brain health strategy being launched, the role for our organization quite changed. We started out with advocacy and political lobbying, trying to get political awareness. But now we have in 2 different governments gotten approval for the brain health strategy. and we are more in a role of being a partner and a coordinator of inputs and perspectives for the Directorate of Health. Because the Directorate of Health established the partnership, which Celia told you about, to secure a dialogue between stakeholders and the health authorities, the Norwegian Brain Council could do a shift in our role. So going from political lobbying more to being a partner. And I will actually say that creating that partnership was one of the main outcomes of the first strategy, because we are now in close dialogue with the health authorities. And our role now is to discuss measures and secure input and perspectives to the health authorities from the broad network we represent. We represent, as I said, 77 different milieux, institutions. And it will be very demanding for the Directorate of Health to be able to have close connections with all those institutions and organizations. So to give an example on how we are working today in creating the new brain health strategy, this year we have been aiding the Directorate of Health in developing and securing content to the new strategy. And we have done this by, for example, hosting several roundtable conferences to get input from members and to secure broad involvement for the next strategy. The Directorate of Health was given approximately 9 months to create the new strategy, and that is an impossible task if they had to be in close contact with all of our members one by one. So we have been coordinating and securing involvement and different perspectives. Yeah, and actually we have also been invited to be represented into internal work group within the Directorate of Health to coordinate the perspectives for from our members. So we have been in very close dialogue, and I think this is probably one of the most important things to achieve when we are building the new strategy. And the reason I say this is because of my take-home message, because I think with only one perspective, it's not enough to find the solutions we need for the future. I think by focusing on challenges and demanding political awareness, you will only get to a certain point. But beyond that point, only cooperation and dialogue will take you further to where we need to go. To find the measures and the tasks we need to achieve together, we have to cooperate, both patients, researchers, medical professionals, and the political health authorities. So this is probably my main take-home message for you, and I wish you all the best of luck in succeeding in Poland to get your own brain health strategy. Thank you very much.
Thank you very much, Professor Persson, and I really loved your take-home message because it's clear, and I really believe that following the multiply perspective and invite multiple stakeholders and develop dialogue between them, give the possibility to formulate the strategy that meets really root needs of the society, yes, from different point of view. So thank you so much, all of you, to show your experience and your perspective. And now we've got a few minutes for the Q&A session. So I ask my colleagues, would you like to ask some questions to presenters? Yeah, yes, okay. Professor Kłakowska, yes, the first question, yeah, I give you a voice.
So
okay, it's good.
Thank you so much for the presentations. Congratulations to colleagues from Norway and from Finland. Great ideas and a lot of hard work. So I'm sure you were able to increase awareness of the society about brain health, about brain health prophylaxis, etc. But as a neurologist, I have to ask a very practical question. Has anything changed for better in the organization of the neurological or psychiatric healthcare in your countries after adaptation, introduction of these brain health strategies, or not?
I'm not a neurologist myself, but I can say that I will say that the work we've done the last years in Norway has actually increased I would say reputation of neurology and brain diseases in Norway. So I think neurologist has gotten better reputation and better working.
So more people know what is neurology, yes, because in general, in my opinion, in society, it's not well known what is neurology, with what diseases does it deal, yes, because everyone knows what is cardiology, ophthalmology, oncology, but what is neurology? A little bit with psychiatry, I think, but neurology is something unknown. Yes, so
but it's better known now, and I think also that the interest for neurology is increasing also, and there's more of a fascination for what is happening in the field, in the population. So I think also the political interest for the field has increased a lot during these years. And this means also positive results for increased funding for research, for example, and also in the prioritizations within the hospitals. Neurologists will come better out now than what they did 10 years ago when nobody knew who they were.
Yes.
To say, yeah.
Yes, I understand. We have to be patient, and it takes time, yes, to change. But we are a little bit discouraged, you know, because we about 3 years ago we launched a plan, strategy for Polish neurology. We presented it to our healthcare authorities, to the Ministry of Health, and I think they are not interested in it much. So it's difficult, really difficult to catch attention of the health authorities to the neurology, to the psychiatry. I think they still don't understand how important are this medical specialization and how many people will need neurological and psychiatric care. Simply. Thank you.
May I just add on this a little bit? So this is an important topic, and thanks for the question. So I think we have to stress that this work that you have to be very patient with. You have to repeat the message over and over, and I think the main goal in the is to both increase the awareness and an understanding of brain and mental health conditions in society. I think particularly in mental health now after COVID and with all the issues of social media and so forth, I think the mental health awareness has improved considerably. People are much better aware that mental health is an important issue, and there might be problems also among the young people in society and so forth. In neurology, I think in practical terms, the things, the main issue is maybe to keep having to keep influencing the decision makers, that we have enough resources both for practical care, for stroke care, for neurological care in all parts of the country. Also to ensure enough funding for research, continuing improving medical care, improving diagnostics and so forth. And this has to be done also on the EU level, but we have to be very persistent, and we need to get contacts to decision makers, politicians, MPs and so forth to really get this through, and this doesn't happen overnight.
Thank you. And I know that Professor Schulz would like to ask questions.
Yes, hello, I'm a psychiatrist, so I'm really very interested in the mental health and in general the brain health, which is, all we agree, very important. But I wonder, firstly, have you implemented any measures just to measure, for example, the awareness of brain health, let's say in the society, just to make, like, I don't know, a survey 10 years ago and now? Do you notice any differences? I can presume that yes, but have you implemented any, strict measures? That's first point. And then I wonder how to reach the politicians, because in Poland, in psychiatry, we have now going through a serious reform to change our paradigm from hospital psychiatry, and now it's almost finished, and we are now working mainly in community centers, but still the first problem is always, and I think the same in neurology, that the politicians have to very carefully count there's money and the budget. So it's always the problem how to convince the politicians that, for example, they need to spend 6 or 7% of health budget for psychiatry, for example. Yes, is it possible? I know that you need patience, etc., but maybe you have, I don't know, magic ways to influence the politicians.
Well, if I may quickly jump in here, although it's from the European perspective, but by experience, we know that when approaching policymakers and mentioning the economic cost that is posed by brain condition, whether it's neurological or mental, they start understanding a bit better what we are talking about, and that displaying these tangible impacts, but also the way it can affect, for instance, productivity. When you start talking about the cost to society, it's easier for them to understand that they need to prioritize research, care, treatment, and so on and so forth. Also because the brain is something that is very abstract to a lot of people who don't know what lies behind, who knows the conditions, because we all do know these conditions. But usually, speaking to policymakers, it really works to highlight the economic impact, although it's of course a narrow view of the burden, but it starts help get them their attention and engage at least the discussion. And to reach out to national policymakers in Poland, I wouldn't be able to say, but something that can be useful is reaching out to your MEP, so members of the European Parliament that were elected in Poland, because they are accountable to you, because you voted for them, and they can connect you back at national level as well. And it can work way easier than it sounds, actually, because they have to answer to you. You voted for them, you elected them. So giving them a call or just writing to them can help a long way, I believe.
Thank you. We try to do that from my perspective and cooperation with EBC, but where we got our presidency in European Parliament, so it gives us, I feel, the better chance to straighten this brain health topic and issue, and we could be more visible and during our presidency with brain health needs and strategy for brain health. We need to be prepared, and I know that we can count on your support, and also based on our EBC colleagues, members from Norwegian and Norway and from Finland, we can really use some practices that you already experience. But I've got the question both to Norway and to Finland. I would like to ask about the first outcomes. Do you measure somehow these outcomes, because you made a huge effort preparing all the strategy documents as well as the campaigns and building the basic knowledge about the brain health and the mental health as well. So do you give us some example of first outcomes you can see right now?
You mean from the first brain health strategy?
Yes, I mean the first at Norway. Yeah, the first 4 years.
I think also I want to add something to Professor Schultz's question. I think just as Hugo said, focusing on economics are really important, but I think also using the global burden numbers are really important. And I think starting to categorize burden numbers or burden data within brain diseases as a category, I think is really important, because then you can show what we did in Norway. We showed the politicians that we have a global burden, Norwegian burden of disease connected to brain diseases of 26%, but within cancer, it's only 16%. Mm-hmm. So that's a really eye-opener for the politicians. So I think global burden or national burden numbers, I think economic numbers, absolutely important. And last but not least, you have to stand together. Because if you go as a professional, you will probably not have the same words coming from one of the patient organizations or from the researchers. But if you go together and you have the same communication, it's much stronger. To the question about the outcomes, I think we have had the evaluation in Norway, which says a lot about the outcomes from the first strategy. We have had established a new research center in Norway on neurodegenerative diseases, which is one concrete outcome. We have also established a partnership, as we told earlier, which doesn't sound like much, but it's a platform and an environment for having discussions with the health authorities. It's really important. And I think also within the awareness, both in professionals, in public and in politicians, the awareness about brain health is surely increased in Norway. And this is also kind of an answer for you, Professor Schultz. When you're doing lobbying and political advocacy, the politicians are only interested in what the public are interested in. So you have to both address the public and the politicians at the same time to increase awareness at both places. So I think the first strategy definitely has increased awareness in Norway as total. Yeah.
I just have to add, we have also made a couple of websites about the brain and brain health and brain diseases. And we can measure how many people that visit the site, where they start reading if they go into other sites, for instance, about the brain and go further into brain diseases, so we can see how people uses the sites, and also give the opportunity to like shifting the information and so on. And I agree with Henrik about everything he's said. And I do have to add that the goals in our strategy that we have now has been difficult because we haven't got so many. It has been difficult because the goals are unprecise, so it's difficult to both have information that we have achieved the goals, but also have measurements to like facts that we have accomplished the goals. So that's got to end, and we have to do something in the next strategy. Thank you.
Mm-hmm. Thank you. And we've got another question from Professor Sienkiewicz-Jarosz.
At first, I would like to thank you very much for your interesting and very comprehensive presentation. I think that many of solutions you have shown for us can be helpful in preparing our own strategy. But could you give us any recommendation from your experience after implementation of your brain plans, of your some solutions for us to preparing this our project, because I think that the problem is to join all stakeholders to ask them to cooperate, because I think it is the main problem. And the second, to implement some solutions. We can give solutions, but we have the problem, usually we have problem with implementation, because as Professor Kułakowska said, we prepared the strategy, but nothing was happened after that. So maybe you can give us some recommendation, some advice. Please help us, maybe.
I don't know if I know exactly what the main issues are in Poland, speaking of political environment, for example, because we live in two different countries with different
usually money.
Yeah. But I think one of the key factors in Norway for success has been that we never made a brain health strategy and presented it to the political environment. We made communication showing that the burden of brain diseases were this high, and these were the problems we were having, and we demanded action. And then we got a status report carried out by the health directorate. And after that, it was actually the Directorate of Health that made the brain health strategy. So we never gave them a strategy to implement, but they made it. We helped them make it. So we made it together, so to say. And I think that is a better way to go if it is possible. Because then the health authorities has so much more control over what they are agreeing to do and not. And you will never get the same type of goals that if you write the strategy yourself, but you will probably reach the goals easier if it's written by the authorities or together with authorities than if you write them yourselves. So I think that is a key point. The other thing I would like to mention is, you said it's hard to get the different organizations and people standing together. I know that's hard. We have gone a long way in Norway, but I will actually like to point to Denmark for an example. We visited Denmark 1.5 years ago and told them about how we established the Norwegian Brain Council and how we established the political advocacy work that we do in Norway. And 1 year later, they established a brand new Brain Council in Denmark with already approximately 30 organizations and members standing together. So I think starting to connect your network tighter together and stand together will give you more impact in the political work.
And we've got, thank you so much. We've got with us Professor Jarosław Sławek. I introduced him at the beginning. He's a former president of Polish Neurological Society. Welcome, Professor. And I know that you've got a question, yes? Because you raise your hand.
Okay, so
now we hear.
Joining this discussion and your experiences from other countries. We have a problem, I think, in the integrity of the organizations who should cooperate and to establish the Polish Brain Council. And this is the main problem. And I would like to ask you, how do you cooperate in every day activity with the neurological or psychiatric or other organizations? Is it competitive, or is there any convergence? And who represents the so-called brain interests in face of the government? Is it the neurological psychiatric organization, or it is Norwegian or Finnish Brain Council? Because I think this is the main problem, that people would like to be to compete and to dominate the stage. Yeah. So, and in my opinion, the Brain Council should be something which is which integrates all the organizations, and how it is in the real world. And maybe this is the extension of this question: how do you cooperate with the government? Are you an advisory board for governments? Do they ask you about what to do in the specific problems, or you have to always apply for your voice and ask them to be listened to?
Could I answer the question? Thanks for this. So in Finland, for the Finnish Brain Council, we have a representation from several professional organizations, including the Finnish Psychiatric Organization and the Neurological Organization. Also the pediatric neurologists and so forth are involved, and psychologists and so forth. And we also have several patient organizations together there. I think this is very important that we also hear the patient perspective, and it also gives us, when we communicate with the government, it gives us a sort of a better backboard, so to say, that we have the support of the patient and the patient involvement as well. So traditionally in the Finnish organization, the chair is usually alternating between the psychiatric organization and the neurological organization, and the vice chair is then the other one. So it's not necessary, but it has been from the start. This has been the way, because these are the two biggest medical professional organizations represented. So we are fairly democratic in this way, that it's every other time the chair is from the neurological and the other is from the psychiatric. So I'm a neurologist by background, and my co-chair or the vice chair in the Finnish Brain Council is a psychiatry professor from Oulu University. So we have a very good communication and collaboration in this way, and from the perspective of advocacy for brain health, we have no issues of competition inside the Finnish Brain Council in this way. The other question is how to reach the government, how to reach the ministries, and how to reach the members of the parliament and so forth. This is I have to admit, it would be better to have more straight and better lines, and also in the Ministry of Health, we obviously do have connections, and they consult for opinion when revising legislation and so forth, but we don't have like an official position so that we would be always and automatically inside the processes of legislation. This is not the case for us, unfortunately. It would be much better if we would have a foot in the door really all the time. But I think it's at the present, it's a matter of personal activity, personal connections. And I think, as mentioned before by others, because the politicians, they need the support of the people. When we can show that the things we are interested in are very important for the public, so then it's much easier. So we have to, that's why the raising the public awareness is very important, because when we can show for the politicians and they understand that these issues are very important for the common public as well, then they get automatically more interested, and then it's easier to think to take things forward. But obviously it's not really easy ever, and I think influencing the policy making on national level and EU level, it requires hard work, and I think we need to collaborate, all of us together, for this. Thanks.
Thank you so much for a very comprehensive answer. We've got a hot discussion, but I need to keep a time, unfortunately, because we need to finish at 3. And to summarize the presentation and discussion, we are terribly thank you for your time and sharing with us your experience and knowledge, and even this discussion, very interesting and deep presentation, and we really get a huge inspiration, a lot of inspiration. We got a lot of inspiration from your presentation to follow up in our dialogue here in Poland, and for sure we will be in touch in forthcoming months as we